19 vaccine. We cannot be driven by misinformation. We cannot be driven by fear. We cannot be driven by all of the stuff that people are saying on social media. We need wisdom about this vaccine. This is why I have asked some of the top physicians of color in the state of Alabama and beyond to join me here this morning as we seek wisdom about this vaccine. Now, one of the things that I love about these amazing medical leaders is that many of them are from our own TWC family. And these are some of the same individuals that have been advising me on a number of ministry issues as we've tried to navigate through this pandemic, whether we open, whether we stay closed, or how do we even begin to think about reopening, or what are the other issues that we've got to process through. We have been working behind the scenes on that since March of last year, and it's been many of these leaders from our own congregation, from our own faith family, that have provided me the necessary wisdom and understanding that I need to make the right decisions to make sure that our faith community stays safe. And so I am so excited to introduce to you this morning some of these amazing medical leaders from our community and beyond. Let me take a moment and let me introduce them to you. There is Dr. Tamara Coyne Beasley, who is the Darrell Dawkins MD Endowed Chair of Adolescent Medicine, the Professor of Pediatrics and Internal Medicine, Division Director of UAB's Adolescent Medicine, and Vice Chair of Pediatrics for Community Engagement. And she's also the past president of the Society for Adolescent Health and Medicine. She is a juggernaut and a gift to not only our church, but our community here in Birmingham and beyond. I want to take a second and introduce all of these individuals with all of their credentials, because I want you to understand that they are experts in their respective field, and we're honored to have them guide us through what we need to know to have wisdom on this subject. I want to introduce also Dr. Leisha Ellis Cox. She is a board-certified adolescent and adult psychiatrist, and she is the medical director of Western Mental Health Center there in Inslee. There is Dr. Carla Williams. Dr. Williams is the assistant professor in the Division of General Internal Medicine and Hospital Medicine. She is the assistant program director for the Tinsley Harrison Internal Medicine Residency Program, and she is also the director of diversity and inclusion for the Tinsley Harrison Internal Medicine Residency Program, all at the University of Alabama at Birmingham. I want to introduce Dr. Samantha Hill. Dr. Samantha Hill is an assistant professor there at UAB, the University of Alabama at Birmingham, and she is in the Department of Pediatrics and part of the Division of Adolescent Medicine. Then I want to introduce Dr. Kalila Brown. Dr. Kalila Brown is the Child Health Medical Director and Laboratory Director for Jefferson County Department of Health. She's also a board-certified pediatrician. Then I want to introduce Dr. Cree Trimble Johnson. Dr. Cree Johnson is the president and sole owner of Brownstone Healthcare and Aesthetics in Trussville, Alabama. And then I'm honored to introduce to you Dr. Horace Smith. Dr. Horace Smith is the professor of pediatrics at Northwestern University. He is the attending physician who specializes in pediatric hematology and oncology at the Robert H. Lurie Children's Hospital in Chicago. And Dr. Horace Smith is also Bishop Horace Smith. In addition to practicing medicine for the last 30 plus years, he also pastors one of the largest churches in Chicago and in the country. That church is the renowned Apostolic Faith Church in Chicago. And for over 10 years, Dr. Smith, Bishop Smith, was the presiding bishop for one of the largest Pentecostal denominations in the world, the PAW, which stands for Pentecostal Assemblies of the World. These are amazing medical leaders, and I'm honored that they are joining us this morning. Would you welcome them? Now, as we get started, I think we first got to start here. One of the questions that I know I have gotten from people all around the country, even friends have called me and said, hey, are you going to get this vaccine? And the question is always pivoted in some way, shape, or form to, I don't know if we can trust this vaccine because, man, it's happened so fast, and it seems like they maybe rushed the process to get this vaccine done. And I know that that is something that is a big concern for many people, which is why I want us to start by taking a look at something that Dr. Anthony Fauci addressed with Byron Allen on this very issue. Take a look.
Well, that's all good news, Byron, really. I mean, I think it's a testimony to the spectacular advances have allowed us to do in less than 1 year, which a decade ago would have taken 6 or 7 years to do. So it's really good news now. Our challenge is to get people to accept vaccination and to realize that the process has been transparent and independent of outside influences. Let me give you an example. Each of these vaccine trials has what's called a Data and Safety Monitoring Board. They're the only ones that have access to the data, because these trials are double-blind, placebo-controlled. So you get an injection, but you don't know whether you got the placebo or whether you got the vaccine. So nobody knows what the results is, but intermittently, this independent board looks at the data. And when they decide the data are impressive enough to say, okay, now let's get the accumulation of the data, show it to the company who has been hands off until now. The company then gets the data and they submitted it to the FDA, the regulatory authority. The career scientists who do this as a living, these are professionals. They're not elected. They're not political. They look at the data and then together with their advisory committee, which is yet again another independent committee with allegiances to no one except the science, they then work with the FDA to decide if they're going to grant what we call an emergency use authorization or even a biological license application acceptance. Only then does you get the distribution of vaccines. So when people ask, this vaccine that you're asking me to take, how do I know there hasn't been some hanky-panky going on to just get it out there for political or other reasons? And the fact is, because as I've said, Myron, the process is transparent and independent, and everyone is going to be able to take a look at that data. So we have got to reach out to the community and explain to them that we've done everything we possibly can to make this a transparent and independent process. Because if you look at the data and look at the number or the rate of hospitalization per 100,000 African Americans or the rate of hospitalization per 100,000 Latinx and compare that with the rate of hospitalization per white, it's maybe 4 or 5 times greater in the African American population because of the underlying conditions that they have that are dictated by the social determinants of health. It's not racial. It's things that go back to when you were a child. You didn't have access to the right diet. Economically, you didn't have the right things. You don't have access to a physician for prophylactic care and preventive care. All of those things are things that we better look at when this is all over and make a multi-decade commitment to get rid of that. But in the meantime, you've got to get those populations tested and easy access to the results of the tests and to care if they need it. So it's absolutely critical that we convince demographic groups that are at higher risk to come in and get that vaccination.
So panel, I want to get started with this, and I want to come first to you, Dr. Cox. I don't think that we can even broach this subject of the COVID-19 vaccine without dealing with the big elephant in the room historically, particularly for communities of color. There have been a number of people that have asked about, man, is the vaccine rushed? But then they've also pivoted and said, I've got some issues and some concerns with the vaccine in light of what happened in the past, and almost always people bring up the Tuskegee experiment. So, Dr. Cox, as a psychiatrist, I want to come to you, but before we do, I want us to take a quick listen to Dr. Wayne Frederick, who is the president of Howard University, because he also addressed this very issue. Let's take a listen.
The reality is, if you stop the average African American today and speak to them about Tuskegee and the experiments there, they can't quite tell you that story in a full, articulate fashion. They may have heard about it, and there are many who haven't. The issue really is a general mistrust in our larger governmental structures because of the systemic racism that has occurred. African Americans have lost faith in our leaders. Institutions that we would expect them to trust, they are walking away from.
So, Dr. Cox, walk us through this with the obvious elephant in the room and the concern that many people of color have with this checkered history of things like the Tuskegee experiment. Maybe somebody else will point to Henrietta Lacks. But in your field as a board-certified psychiatrist, how are we to process through this as we begin to talk about the importance of this vaccine?
You know, that is such a great question, Bishop, and we cannot negate the reality of the legacy that Black people have faced in healthcare since enslavement. And as you pointed out with the Tuskegee syphilis experiment, this was a tragic undertaking that started in 1932, and there were 600 men that were enrolled in this study, 400 or 399 that had syphilis, and the remainder that didn't have syphilis. And this study was problematic for several reasons. One, these men were told that they were going to be treated for bad blood, which is generic. That means, and at that time meant a number of things that can include anemia, syphilis, and other conditions. Then they were told it would last 6 months. Well, it actually lasted 40 years. And then on top of that, when effective treatment for syphilis came, and that was penicillin, they were not given the opportunity to start treatment. And so it meant that these men went without clearly effective treatment for decades with tremendous impact. And so as people of color who are familiar with this story, it really makes us pause and think, well, is this something that could still be playing out now with this COVID vaccine? And I will say that I think it's important to validate those concerns. We cannot negate what happened. That would be dismissive and unhelpful. However, there have been things that have changed around medical ethics that I think are important to highlight. So one is this idea of informed consent. So as I said initially, there was really no informed consent, which requires that people know that their participation in studies is voluntary, that they can make decision-making capacity, that they have that decision-making capacity, and that they are aware of what the treatment is and what the risks and benefits of treatment. And so what happened with the Tuskegee syphilis experiment was just bad blood. There was no mention of syphilis specifically and what treatment looked like, and particularly that they were going to be withheld from receiving treatment. So we have informed consent now in place, which is a huge protection. And then I think the other thing is we have the Institutional Review Board that is required to evaluate studies, research studies, and make sure that protections are in place that safeguard humans. But we also have the story of Henrietta Lacks, who unfortunately she had passed away from cervical cancer, but her cells were harvested without her permission after her death. Her family wasn't aware of what happened. So again, we have these things that have happened, and there are many other stories that have happened in history, but things are better because we do have protections in place, and research doesn't happen the way that it did decades and decades ago.
So, Dr. Smith, Bishop Smith, how do we then navigate through the skepticism, particularly that is deep-seated, whether it is historical or contemporary, in communities of color as we broach this subject of the vaccine?
Well, I think Dr. Cox pointed out a couple things that we have to look at. First of all, we don't dismiss people's fears, but one thing we should say in the face of this pandemic, there's some things that we know without a doubt. We know that every day, 3,000 Americans are dying from COVID-19. We know that African Americans, Hispanic Americans in Chicago make up 70% of the death from COVID in this city. We know this. We're not speculating. Tuskegee is real, but it happened beginning in 1932. And I don't even call it Tuskegee because it really was the Federal Public Health Department that devised this study. And there was no IRB, there was no oversights. But brothers and sisters, that was 88 years ago. And so we cannot look at that as a touch point to our fears in the light of we know people every day who are dying from COVID-19. The other point is that if you look at the history of COVID, Black people, people of color have been at the forefront of the development of vaccines. Dr. Corbett owns the first 4 patents for mRNA technology. Black universities like Howard and others have been at the forefront of clinical trials. So it's not like 1932. Right now, we have trusted voices that we all know that are not only being informed, they are oftentimes the researchers, people behind these things, so that the truth of the matter is that every day that we have skepticism and we delay, our people are dying. We know that. This week I said to a group of pastors, as of today, 43 million Americans have been vaccinated. 43 million. They're not dying. As of this date, 145 million people around the world have received these vaccines. So if we're waiting, I ask the question, while you're waiting, people are dying and there really is no alternative. So I think we have to be very careful. Our fears won't save us from the virus. It's a novel virus. No human being was born with immunity to it. So we have to ask ourselves the question, what is the truth today? And so if you utilize what we know the facts of death, we know the facts of long-term disease. We also know that Black people and brown people who are trusted, the NMA, which is the largest African-American, Hispanic-American national group of physicians and scientists, have all endorsed because they've looked at from step 1, the development of these vaccines. So these conspiracy theories, they only cause us more harm. So I'll just caution Black people, we're already behind the 8 ball. Don't stay behind it because it won't protect us.
Yeah, Dr. Smith, you said something that I think I want to make sure that we don't rush past because it was something that I recently learned. You referenced Dr. Corbett, the African-American woman who I think 5 of the 6 vaccines, has her research and she has a patent in them. I honestly, I did not know that. I think early on, I was one of those that had a lot of questions and skepticism because I just was uninformed. And when I began to find out who she was, it was kind of like the Hidden Figures movie, that story. I had no idea about the African-American women that were critical to the NASA space program. And so, in fact, we have a little bit of information that I want to share with our audience this morning about Dr. Corbett. Let's take a look.
I started working at the NIH in 2014. So I've been there for 6 years now, and the patent that's being used in 5 of the 6 leading vaccines is mine. So, and that patent application was submitted in 2016. The manuscript describing the mutation that's encompassed in these vaccines came out in 2017. It's because we've done so much work on previous coronaviruses that it really fueled the vaccine program around this particular coronavirus. So the umbrella of vaccine development that my team works under is called pandemic preparedness. That's the entire idea. The idea is that there are 24 viral families, and at any given time, one virus from one of those 24 viral families can jump into a human and cause what we're seeing today, a deadly, devastating global pandemic. So what we need to do is we need to have teams that study each of those viral families in so much depth, have an idea of how to pull the trigger on a vaccine very quickly, and be able to monopolize on that basis of scientific knowledge. And so that's what my team has been doing for the last 6 years.
Wow. So, Dr. Coyne-Beasley and Dr. Williams, I want to pivot to you now and really pull on your wisdom, because I took it upon myself when the Pfizer report was released. I just tried to read it. Now, I didn't understand half of what I was reading, but I wanted to understand how this vaccine was produced so quickly, because a lot of the questions that I get really revolve around two things: the product, like what's in the vaccine, and the process. How was it created so fast? And so I read the Pfizer report. I had to call another doctor to give me translation, because it was like Greek. I can read Greek. So another language. It was like, I don't know, Latin or something that I couldn't quite understand. But would you, Dr. Coyne-Beasley, and then Dr. Williams, would you weigh in on that? Like, what in the world is mRNA? Talk about the actual product of the vaccine, because I've heard all kinds of stuff. People say, that there's some kind of chip in it and they're going to track you, or they're going to turn you into a robot. I've heard all kinds of craziness. What is mRNA? Talk about the product. And then, Dr. Williams, would you talk about the process and however you guys want to get at that? But I think that that's critical as we explore this vaccine.
So mRNA stands for messenger RNA. And while we may think that it's something that's new, it actually is an old technology that actually has been used for the prevention of cancer. So it's just applying a new technology, a technology that's been around for a long time to a new purpose, which is vaccine development. So in fact, that wasn't anything that was done really quickly. There had actually been some discussions previously about using this technology. I think the thing that's important for people to understand without getting really technical is that mRNA is not DNA, and it doesn't change a person's makeup. It also isn't a DNA that's derived from an animal, which many people are curious about. Where's this DNA, this mRNA coming from? And it's not meant to change the component of the individual that it goes into. Now, the mRNA actually is built around a protein that's in the virus. And this protein, again, doesn't change an individual's protein, but the protein causes the reaction in a person's immune system. It's kind of mimicking the virus, but it's not a virus. It's not a live virus. And the mRNA allows it to replicate in the body such that the immune response continues to get stronger. I think the thing that's really important for people to understand is the process, and again, Dr. Williams will talk about this as well, is that the process itself wasn't rushed. And what I mean by that is that it went through the same process all vaccine development goes through. And I can say that as a member of the Advisory Committee on Immunization Practices. So I've been involved in the committees that have made vaccine policies for many, many years. And so what is different is the long-term follow-up, meaning that we don't have the history of 10 to 6 years as we would normally with certain vaccines. So what the process was, it still went through enrollment of clinical trials that had thousands of individuals who were in the trials. Yes, we would have loved to have had more diverse participants, meaning more people of color. However, compared to most vaccine studies, it was it was more diverse than any other vaccine study that I've actually seen. And it went through the process of being evaluated by the major federal government agencies that review vaccines, like the FDA, the Federal Drug Administration, and again, the Advisory Committee on Immunization Practices. What happened in terms of the process, the scientific process, there were no shortcuts on that. And I think that's what's important for people to know, that nothing was cut in terms of making sure the vaccine was safe, and that was incredibly important, and making sure that it was efficacious. And another way to think about efficacy is how well does the vaccine work in the population? And these two vaccines that are currently in the United States, the Moderna and the Pfizer vaccine, have efficaciousness that's greater than 90%. In fact, it's 94% in one and 95% in others. So again, very, very high efficacy, even higher than many of the vaccines that we currently use now. To get it to the emergency use authorization, an emergency use authorization happens when you have such a significant disease in the population and there are no other alternatives available that you make it available in an emergency situation. However, it still has to be high quality, it still has to be safe, and it still has to be efficacious. And the Advisory Committee of Immunization Practices was really meeting almost on a weekly basis, reviewing the data. So none of this is shortcutted at all. Again, why it could come out as fast is because we didn't wait for 5 to 10 or 20 years worth of data as we do with some other vaccines. And there's just one more thing I want to mention is that most of these vaccines also, because they're being developed under emergency use authorization, have external advisory board committees as well. And I can tell you that, particularly with the two vaccines that have been developed, that the external advisory boards, and I actually am on two, are looking at this data as it's being developed, helping people to actually recruit individuals. So when we think about people of color, they're not only involved as scientists, they're also involved as external scientific advisory board members. They also are advisory committee members of the Immunization Practices Committee, and they're also members of the FDA. And I don't want to forget Dr. Corbin, who was critical to really helping to develop these vaccines.
So Dr. Cohen-Beasley did a beautiful job of describing mRNA as well as the process that vaccine approval or emergency approval goes through. I just have a few pieces of information to add to that. I get this question a lot with the patients that I treat and their family members. I do treat patients that have COVID and have since the pandemic began. And one of the things that, is really a concern for patients and their family members is, does this vaccine have any of the virus particles? Are they putting COVID-19 in me? And I like to describe mRNA kind of like a recipe, right? mRNA is the instructions. It's just a set of instructions on how to make that cake or the cookie. It's instructions on how to make that protein that our body needs to recognize as an intruder so that we can mount a response to it. And so there is no particles from the virus that are actually being injected into your body. These are only the instructions on how to have your body produce that protein so that your army cells can recognize it as foreign and mount the appropriate response. Just one thing to add to the process, which I am not a researcher, but learned more about myself during this pandemic, is that, one of the reasons we were able to manufacture these vaccines and get them passed so quickly through the emergency approval is because this is probably the only time where we have had a worldwide focus that has been on one thing, right? On the vaccine, creating a vaccine. And so with that, you get funding that is put towards that. With that, you get the resources, the laboratory space, and I'm sure Dr. Cohen-Beasley can speak towards that. With that, you get a number of boards that are put together to kind of make this regulatory process work more effectively and more efficiently. And so it didn't take the usual 10 to 20 years sometimes that we see with our normal vaccine and drug production. One, because of the emergency situation and because we have the boards in place, but also because we had the funding and because we didn't have to go through as much red tape to have the work done in the laboratory and to have the appropriate resources.
Yeah, Van, can I add to that? I think that they've explained it, and let me put it in terms that our Black church folk understand. When you develop a new medical therapy or you develop a vaccine, these companies undergo great economic risks. Mm-hmm. They put in millions of dollars over years to develop something. Guess what? Our government, to its credit, said, I'll give you $2 billion upfront guaranteed. Not if it works. Our government probably used about $6 billion to private companies upfront, guaranteed. And many of these vaccines were made before they were tested. That may make people a little bit reluctant, but it shouldn't. Here's what they said to the company. We'll take away from you any economic risk. We take the risk by paying you up front. And as Dr. Williams said, and Dr. Beasley said, so you can hire folk to work 24/7 and pay them with no economic risk to the company because we paid you already. That has never been done before.
Wow.
In America, money talks. So so these companies, and I won't mention one name, where they actually help them build the laboratories, build the factories, and pay for them up front. They should have done that. Why? People were dying. And so we can understand that one of the reasons, the genetic part, you're correct, all those things, but they had almost no economic risk to Pfizer, to Moderna, and these companies. They were paid by the U.S. government up front.
Right. And they knew that they were going to have product that they would be able to sell. They actually also had contracts for the product after it was made. And just to set another context for an example where this has actually happened relatively quickly too, for those of us who remember the Ebola outbreak, they were actually able to, for the same scenario, able to generate a vaccine within about a year's time. And so we know that we can do these things when we actually have emergencies and when we have the resources and the need to do that. So the only other thing that I would say too is that technology continues to evolve. And if you think about how we communicate and how we now use our technology and the scientific techniques that we have, those have advanced throughout time as well, that make some of the things that were more difficult in terms of making vaccines easier because of the technological advances.
That's good.
If I could just add to Dr. Foyn-Beasley, one of the exciting things about this and the science behind this virus was that by the time the virus was actually here in the United States, so this is probably around February, the genetic sequence of this virus was already known.
Right.
That is amazing. We had just heard about it being in China in probably November, December. And by January, we knew the genetic sequence of this virus to even begin making a vaccine.
That's right.
Wow. Wow. So let me pivot and then ask Dr. Khalilah Brown, and if others of you want to chime in, let's talk specifically about two things. What's happening in Jefferson County, we're inundated locally with the news about Alabama being number 50, I think is one of the recent articles I read as it relates to vaccine rollout. Lots of questions about Jefferson County and really the divide between the older and the younger. And there are lots of questions, can young people get vaccinated? There's lots of concern around, when will older people get vaccinated? An individual from our ministry staff, their mother was supposed to be getting vaccinated recently and then has some fears around it. There was a recent article that came out about a woman who took the vaccine and then passed recently. So from a Jefferson County perspective, help us understand the kind of vaccination approach. But then I want to pivot to you, Dr. Sam, and to all of the doctors to really begin to talk about, helping us to separate fact from fiction, knowing that there's so much fear in our community. Dr. Sam, one of the things that I really appreciated, you and I talk offline, and you mentioned to me how initially, obviously there was a little bit of hesitancy maybe that you even had, or maybe some of your friends possibly didn't expect you maybe to get the vaccine, but then you ended up getting the vaccine. And I want to talk about what's happening locally, but then, the vaccine rollout. My wife and some of our leaders pastorally are now in the priority one space, and we've had an opportunity to get the first round of the vaccine, the Moderna vaccine. But there's fears even in, our community about it. Should we get it? Should we not get it? I can't believe you got it. I talked to somebody and they were like, man, I can't believe you got the vaccine. So Dr. Brown, would you talk about that from a Jefferson County perspective, but then Dr. Sam and to all of the doctors, how do you, separate that fact from fiction and begin to walk people through the truth so that we can get the help that we desperately need?
Okay, so from the standpoint of vaccine rollout, the federal government sends vaccine, but each state was required to come up with their own plan. And so the state of Alabama, went on and used the staged approach that was put out by the federal government and CDC that basically looked at things from a fairness standpoint and equity standpoint, that looked at who's at highest risk for this disease, who's most likely to die from this disease, and then how do we get it to those people in an equitable manner. And so what's going on in Alabama is we get our vaccine on a per capita rate. So Alabama is a very rural population for the most part for states. So we're getting a lot less vaccine than you would in other areas, in a New York, in a California. So even though I think we're number 19 for COVID-19 per population, and I think we're 16th state for deaths, we still only get vaccine based on our population. So from once the state gets the vaccine, then they send it to each county, again, based on population. Well, Jefferson County is the largest populous county in the state. We have over 640,000 residents just here in Jefferson County. So trying to figure out how to get that vaccine out in a timely manner to those folks has been a challenge, mainly because we only have a small health department compared to the size of our county, and so we've had to rely on other partners, the hospitals. We've now had pharmacies come online, but really until we get big box pharmacies in, it's virtually impossible to vaccinate 640,000 people quickly. The other thing that kind of hindered Jefferson County just a little bit is when you think about us per capita, we have a lot of healthcare workers. And so that was our 1A priority as healthcare workers. So we had a lot of people we had to vaccinate first before we could then move on to the 75 and up. So currently we're in 1B. We've expanded to 65 and up. Those essential workers, police officers, firefighters. So we're expanding quickly. We're actually going to have Walmart and Sam's will be coming online in Alabama next week, which I think will be huge. ADPH now has an online portal where you can go on and find out where there are vaccines and get appointments. So we've come a long way in a short amount of time, but we didn't get there as fast as we would have liked to get there, but we just didn't have the capacity to do so. Right now, I think our rate limiting step really is getting the vaccine because of the numbers that Alabama is getting. We have more capacity now. UAB has a capacity to give 17,000 vaccines a week. Health department is still doing vaccines. There's lots of private pharmacies that are doing vaccines. There's doctors' offices that are doing vaccines, but we don't have enough. They're trickling in. And so as soon as we get the vaccine, they're gone. And so you have to kind of sit on a waiting list until we get more and we can pull people off the list. So once the government gets us vaccine, we try to get it into an arm. So once we start getting more vaccine, and President Biden has ramped up that production, is really pushing for more vaccine to come out, I think in the coming weeks, we will see a significant increase in the number of vaccines given in Jefferson County.
In the population right now, the focus is 1B, 75 and up, essential workers. I don't know, honestly, how pastors got into that role, but I'm thankful for it. But I was, very curious and surprised when I was contacted and said that, hey, pastors are now, in that priority. But what about kids? I mean, how is this, with Alabama having a slow rollout, how is this going to impact our children? Because the initial thought about children has changed so much. First children couldn't get it. Then they, all of the thinking around it has evolved so much. What should we be thinking about now as it relates to children?
So as for our children, Pfizer vaccine is okay for people 16 and up. Moderna is 18 and up. Those are the two vaccines that are currently on the market. There are studies going on with children from 12 and up, and we hopefully will start seeing some data from that. But what we've learned, and part of why the information coming out seemed to kind of wax and wane and go from one direction to the next, was because it was new and we were learning and figuring out what's real, what's a short-term trend, what's a long-term trend. We know that children middle school age and up can transfer the virus and pass the virus just like adults. The younger ones tend not to do so. But we also know that children 18 and under have a significantly less virulent response to the virus. So they tend to not have the comorbidities. We've not seen the death. Now, have we had some? Yes, we have. And when it's your child, that one means a lot to you. But when you look at saving, 400,000 grandmothers versus the children having, relatively mild symptoms, and a good number of them are asymptomatic, which is why it spreads so quickly through the community. So now that we've understand that you've got to wear your mask, and we've got the children social distancing, and they're washing their hands, we've seen that we can do schools and have lower transmissions rates if we do them correctly. So we're going to get there, but again, it's built on equity. We've got to get those that are most vulnerable first, and then we will get to the children. But we've also got to study it in children before we ever feel comfortable giving it to our children, and that's coming.
That's good. Dr. Sam, Dr. Cree, and other doctors that jump in, I want to direct it first to Dr. Sam and Dr. Cree. What are you saying to your patients? Talk about the hesitancy and separating the fact from fiction. Dr. Sam, as I mentioned, you shared with me that some of your own friends questioned, have you lost your mind? How did you get not necessarily how, but why did you get the vaccine? Talk about that as doctors, as medical professionals, how you process through it, but then also how you're helping your patients to process through it.
Right. So for me, I think as soon as the vaccine became available, my first question is always the question I encourage my patients to think about is, what information do you have available to you? What are you thinking and feeling at this moment? And who are the key people that are in your group that have expertise, right? Not internet expertise, but expertise in whatever you're thinking about. And so unfortunately, I have a bias in that I am a healthcare professional. I'm also a researcher and can read and understand the EUAs with relative ease. Compared to the general population, and read it and looked at it. And even though I had slight hesitation, one, I was lucky enough that I received an offer from my institution to get the vaccine, and that I had enough time to actually read the documents, ask some questions of some mentors, again, those people that have expertise, and make my decision and sign up to get the vaccine. I did not take weeks to deliberate. It took maybe a day, 24 to 36 hours, because as Dr. Brown has already mentioned, the supply is limited. So it's important for you to think about it. You've already had access to someone saying, hey, please sign up for this vaccine, that you do a quick assessment of yourself, figure out what questions you may still have, reach out to, again, people with expertise, but then sign up for the vaccine, because you don't know when that opportunity is going to come again. And so I also tend to be very vocal with the community that surround me. And so as soon as I received the vaccine, I actually posted it on my social media. And I had 2 people reach out to me automatically within hours of me making that post. The first one was my cousin, who is approximately my age. I won't give my age, but mid to late 30s. He and I are very similar, except he is a smoker, so that is a risk factor. He actually shared to me that he was in the ICU with COVID in the summer and was actually about to be intubated. He thought he had already been intubated when he had a nasal cannula in his nose, which was his kind of understanding of the process. But he actually was about to be intubated and was lucky enough that his insurance approved one of the more experimental treatments at the time, which was remdesivir. So he asked me, he called me, he's like, so what happened? How are you feeling? I'm really calling to see if you're even still living, because you got this vaccine. I know I know I survived COVID, but you got this vaccine and I don't understand. And so we sat and we had a conversation. And I think a lot of this is about having these conversations with people that are in your sphere of influence that you trust. We are all amazing people on this Zoom call right now, but you may not have access to us or may not know us personally. And so find those people in your community that have that expertise, who you trust, to have these conversations with. And so we had that conversation, and I was actually surprised. Within the hour, he actually posted, I just talked to my cousin, that's me, and I'm actually going to go get the vaccine when they offer it. It's a huge, this is not someone that I talk to every day or every week. We see each other usually holidays. But the one that caught me off guard is my best friend of 20-something years. And she also reached out within a couple of hours of me posting to social media. We are all a little extra as far as trying to be healthy and taking into account what goes into our bodies and things like that. And she really had almost like a panic attack for me. Why would you put something in your body, you know better. We were raised very similarly. It was this whole discussion. And what I'll say, because I use her as an example of just having patience, both Dr. Bishop Smith and Dr. Cox talked about the importance of being able to listen to people's stories and their stories about concerns and things that have happened to them. And we have had conversations over the course of the month. I never said, you're being stupid, or, I never belittled her for her experiences. And I sat and I listened to what she was telling me. And we just literally had a conversation, question, answer, conversation. And it took her about 6 weeks, but she actually changed her mind. She had, to my knowledge, I didn't realize she had been offered the vaccine 6 times through her institution.
Wow.
She works at a healthcare institution and had been offered it 6 times. And by the 6th time, she actually changed her mind, not only signed herself up, but her institution had a policy where they vaccinated everybody in her family. So she was able to get her husband the vaccine as well. And so I use those 2 examples because sometimes being honest with yourself, figuring out your own concerns, your own hesitancies, thinking through the process you went through in your mind, which again, I'll admit I was hesitant for maybe 24, 36 hours, but that's still hesitancy. And having these conversations with your colleagues, your peers, your community groups, your mentors, your friends, your family is super important. My mom has cancer. My mom is also someone that's not really keen on new types of medicines and things. And an example, and not to put her information out there, but she chose not to actually get chemo for her cancer and is doing well. I'll say that. But her first question was, Samantha, what about me? Should I get the vaccine? And so we had an honest discussion. And though I'm a healthcare professional, my answer was yes, but you need to check with your doctor first. And so making sure that you're asking trusted people. It would have been easy for me to say, yes, don't even worry about it, go get it. But I don't know what's going on with the particular regimen she's on since she's not on chemo. And so for people out there that might have different underlying conditions or health factors, get information from your colleagues, your peers, those trusted individuals that are within your sphere of influence, then make sure you're talking to your healthcare professional, your physician as well.
Dr. Cree, how are you helping your patients? What are you saying to them? You're in the heart of serving, our community in a variety of ways. I know that you've encountered a lot of the fiction, and you're trying to help people navigate through to fact. How are you helping to address that? What are you saying to them? How are you addressing the vaccine hesitancy that's prevalent in our community?
I've been telling them more about my own experience because, like Dr. Samantha, I was afraid and nervous in the beginning as well. But it's nothing like COVID getting close to your house to make you change your whole mind. So my entire staff had COVID and my in-laws had COVID all within a week of each other. Wow. And so this was about the exact same time that it was going through the FDA process and all of that. So I was like, yeah, I was going to try and wait on that. But I think I changed my mind. I didn't read a pamphlet on it. I just said, it's getting too close. And I just went, I signed up, I got an email and they said, you can go and you can bring your staff. And so I was like, yes, a no-brainer. And my dad has cancer, my dad's a pastor. And so I started calling his doctors and who were my mentors, like she said as well. And they were like, it's a no-brainer. You sign him up as soon as he can. You get it as soon as you can. So for me, I was like, oh, I'll just wait. But like I said, once I saw how they were feeling and the idea of my mother-in-law being in the hospital and she had pneumonia and just living through that. And it was enough for me to say, I know what COVID does. I know that it kills. I know that you can be on, oxygen for the rest of your life. You can be on dialysis. I went down the list of the things that I know that I was seeing and I didn't want that. I took that, my arm was sore. I had headaches after I had it and I itched really bad after the second shot, but I would do it all over again. So I suggest that you guys talk to your, primary care physician, talk to your specialist, and ask them and get that true, impact from the people that have had the shot and also who know the research and who know your history. And because they know your history, you trust them. And go forward. I want to get back to normal. I want to travel. I want to do fun things, but I don't think that we can do that unless we all get on board and we do what we have to do. So my advice is just do it.
So, Dr. Smith, Bishop Horace Smith, I want to come to you, and then Dr. Cox, and then I want to close with Dr. Coyne Beasley. What do we say, Bishop Smith, Dr. Smith, to the saints who believe that, I got Jesus, he's a healer, which he is. I'm going to put some oil on this thing. I'm going to exercise my faith and believe, and I don't need the shot. Like, what are you, help me, Bishop. You are a leader in this field, medically and spiritually. You've been a distant mentor in my life for a very, very long time, and you're a constant encourager to me. I need you to pastor me right up and through here. What do we say to that person who's like, I got Jesus, I'm good?
I think you speak to such an important point. Let's forget about the pandemic for a moment. Before the pandemic, who did they listen to? And why did they listen to them? Your source of truth is going to always determine your quality of life. So our job as leaders is not to simply feed fears when we know they're fears that are unfounded. We know that the enemy comes to do three things: steal, kill, and destroy. Well, guess what? That's what COVID is doing. So I've got Jesus. I know personally of 30 pastors who have died from COVID. Some of which told me 3 months ago, I'm not taking the vaccine. I'm not doing any of that. One of the most tragic cases was a guy in his 50s. His son said to me, can you get my father to stop preaching against mitigating practices? He went to the hospital, and in 2 weeks he was gone. Faith is not fear. Fear keeps you to believe in something that's not true. But the truth of this, we all know, is that it's a virus, and now we have some protection against it. So if you trust me as your pastor, and that's why I say to all leaders, the doctors on this panel will tell you that the number one journal in medicine, perhaps, is the New England Journal of Medicine. It's been in existence for 105 years. It never talks about social issues. It's always about science and medicine. Well, guess what? In October, it wrote an editorial. And here's the title of it: Death in the Midst of a Leadership Vacuum. In this country, back in February, we predicted as scientists that with our resources, with mitigating practices, we should have lost maybe in a year 40,000 Americans. Well, guess what? We've lost 470,000 Americans, not because we didn't have the truth. We were egotistical, we were arrogant, and leaders did not prepare the people. So subsequently, the people have been dying. I would hope that pastors would understand that we've got to get trusted people to come out to our pulpits. When I got my shots, I went online immediately. I got my first one, the second one, and I'll take a third one because I know the truth. I'm not going to let the enemy kill me because of fake faith. That's all that real faith is what God has said. Why would the Lord send something that brings deliverance and you think that it's killing you when you know it's killing you every day? It's almost as if we've been deceived. So I think that as leaders, we're going to have to understand, if you have influence with your people and you've been that role model, you've been that voice of reason, then they got to listen to you and not to the naysayers, because if they don't, the price is too high. I'll just say this and I'll stop. I came from a Pentecostal background. When I was 18 years of age, I told the saints I wanted to be a doctor. And they told me, you can't be no doctor. We believe in Jesus. This is a true story. 1 month later, my pastor, who was way ahead of his time, said to me, what's wrong with you? I said, nothing. He said, no, you're depressed. What's wrong with you? I said, well, I told the saints I want to be a doctor. He said, what'd they tell you? And they told me, we don't believe in doctors, we believe in Jesus. He said, son, those folk are good people and they're dead wrong. Boy, stay in school. You've got to understand that we must use our voice, even sometimes. I know we have to affirm people's hesitancy, but that's different than fear. Fear will get you killed. Fear will take out your family. This is not dramatic. We know families that have died from 2 or 3 generations from COVID. We know that. And so we've got to use trusted voices. I've always said that faith and science are never adversaries, not true science. All true science comes from God because science delivers us, doesn't kill us.
That's right.
Last thing, I said to my nurses, because when I got my first shot, they said, Dr. Smith, you got your shot, aren't you afraid? I said to them, all of you tell me, how many vaccines have you gotten in your life? No less than 30, all of them. All of them have gotten vaccines before from disease that didn't kill you, but not one that does. You question it. Something's wrong with that rationality. And so I think we've got to be dramatic with people, not to belittle them, but say to them, hey, I love the Lord too. My faith is strong. And when God sends deliverance, I'm going to take it. I'll say, if there had been a bridge at the Red Sea, I don't think God would ever have parted it. He said, hey, Moses, go down there 3 kilometers, there's a bridge. But there was no bridge, so he parted the Red Sea. But we want to tell God how to deliver us. He sent deliverance. If we ignore it, shame on us. So pastors, I say to all my brothers, sisters, get your folk vaccinated so they won't die.
Amen. Amen. Well, my wife and I and our leadership team, we've gotten our first round of vaccinations. We also, when they made pastors priority 1, we sent it out to all of our pastors and ministers, encouraging them to do that. We're going to close, but I want to go to Dr. Cox, because part of why we're doing this Sunday and next Sunday is to really try to separate fact from fiction. Good. To arm our community with as much information so that they can make the best decisions. But Dr. Cox, I am aware that there's still going to be people that will listen. Hopefully, many more people will make the right decisions. But there's still some very obstinate and stubborn people who just say, I'm not, like that pastor that Dr. Horace Smith talked about. So talk briefly about the mental health fallout of not getting the vaccination.
Yeah, I think there is a lot of focus that has been centered around what happens when you get COVID. Obviously, physically, you can die. You can have long haulers syndrome where you have persistent symptoms long after you recover from the acute phase of COVID. But the other pandemic that is generating a lot of attention is around the mental health pandemic that's happening. So we know that for people who already had mental disorders, there has been an uptick in symptoms. We know that for people, including our children, who didn't have problems with mental health symptoms prior to the pandemic, the cost of isolation, prolonged isolation, is significant. We have seen what are called deaths of despair. So that talks about suicide, that talks about escalating alcohol use, and that talks about opiate deaths. We have seen an increase in emergency room visits for kids around depression and anxiety issues. We're seeing, like in Las Vegas and one of those school districts, a rash number of suicides. So there is a tremendous cost, and I don't think we've even seen the half of it at this point. So I would say, not only are we talking about protecting our health physically, but our mental health is an integral part of our health. We don't cut off the neck and from body down, neck down is one thing and neck up is another. We are all one body, one mind, one spirit. And so we have to think about those implications as well. And then just for our children, for our kids who were struggling academically, if they had special education needs, if you have kids with learning disabilities or with autism or other conditions, they have been struggling in remote school. And yes, there's concerns about safety, but as Dr. Brown already pointed out, that risk physically in terms of COVID is low overall. But we are seeing our children struggling. The academic gaps are growing. And so if we want to get back to some semblance of normalcy, to keep ourselves safe, to keep the people that we love safe, to, as Dr. Cree said, let's get back out living, traveling. I want to hug my friends' necks. I want to see my parents. I want to see my siblings. I want to live again. And I don't want to be struggling with depression and anxiety. I don't want that to be what happens to my children. Then you have to get vaccinated. There is no other way around this. And obviously, yes, you need to talk to your primary care physician and your specialist about your unique concerns. But COVID is killing folks, dead. And we have got to beat this. And vaccination, what is it, Hamilton? Not gonna miss my shot? Don't miss the shot. Don't miss your shot. And I'll drop the mic on that.
Can I say something quickly to that, to what Dr. Cox just said? Because I do hear a lot of people, we didn't touch on this, but I hear a lot of people say, well, I'll just wait for herd immunity. So the idea that enough people in our population are vaccinated to provide protection for you who chose not to get vaccinated. And I just want to say, that idea is flawed, because there are people in our society that actually cannot get vaccinated for some type of medical reason. And so when you hear people like Dr. Fauci talking about 75, 85% of us, at least in this country, not even including the world, need to receive this vaccine in order for us to actually have everybody in our country protected. Those of us that have the ability to get vaccinated and are choosing not to because we just don't want to get the shot, we're afraid of shots, whatever your reasons are, we're really prolonging that ability to get to herd immunity. And so it's extremely important that for everybody that can hear this voice, if you have the ability to get vaccinated when it's your turn, pray. That's what we're supposed to be doing anyway. Say your pray, ask God for peace about making the decision to get vaccinated, and go ahead and get the little needle in your arm. Because we have to move on from this. And as Dr. Cox says, whether it's physically or from mental health needs, people are passing away. And when they actually do the final numbers of how many people have passed away from this pandemic, and they add on the mental health deaths on top of the physical deaths, most of us are going to be super surprised, extraordinarily surprised at how many people in this country and in the world have passed away because of something COVID-19 related.
Exactly. There is actually one last thing that I'd like to say related to history.
Yeah.
So when we focus on history, can you hear me?
Yeah, I was going to say, I want to come to you, Dr. Coney-Beasley, to close us, largely because this whole conversation started, and this is just part one. I know that there's a lot we didn't get to, and that's why we're going to get next Sunday into part two of this wisdom that we need for our community. But Dr. Coney-Beasley, I wanted you to kind of close us, because this started with a text conversation between you and I over the Christmas holidays. And I'm so grateful to all of you for the wisdom that you've been providing to me and to our church family on this journey. Dr. Smith, you've been a constant source of just inspiration and encouragement to me throughout the years. So I want to personally thank you all for that. But Dr. Coney-Beasley, would you give us kind of the final word or the final thought?
Well, at first, I'm just so grateful for everybody who's on this panel. But what I want us to remember, for those of us who can remember, and sometimes when good things happen in history, we don't really recognize it because we take it for granted. But when we think about vaccines are actually one of the top 10 advances in public health. It's the absolutely only thing that has ever eradicated disease and reduced health disparities. No other medicine or no other medical device has gotten rid of an actual disease process, whether it was heart disease or anything else. And some of us aren't old enough. I think Dr. Smith and I are old enough to have gotten a smallpox inoculation, which I still have that scar on my arm. We don't see smallpox. In fact, we actually consider it to be eradicated around the world. Some of us have, my best friend's mother had polio and was paralyzed the entire time I knew her. We don't see those things anymore. And not only have vaccines been the only thing to reduce the disease and the health disparities that come from them when you reduce them or even eradicate them, they are actually the only thing in medicine that is continually evaluated throughout their lifetime. So if that Tylenol you took or that you may take, once it's been put to market, it's never looked at ever again. Those of us who go to GNC stores, which we think are healthy stores, haven't even been evaluated in studies or by the FDA whatsoever. Vaccines, that medical device, if you have AFib and you have something that activates your heart, once it goes to market, nobody looks at it again unless there's any malfunction. Vaccines are the only medical product that we have that are continually monitored. And I know that because I've done it as part of committees. And so within every 5 years, whether you need it or not, vaccine recommendations get reviewed. But even through that, so for those of us who are a little skeptical about the COVID vaccine, know that it's not over, that people are still continuing to gather data about its safety and about its efficacy, and that will continue through the life course of that vaccine. And you have to know, and this has happened before, if there are any safety signals that determine that a vaccine is not safe, it gets pulled from the market. That doesn't happen anywhere. So COVID vaccine is incredibly important. One, because it's highly effective. We know it's safe. We'll continue to monitor its safety. And if it turns out that it's not, it will come off before damage is done. And we know that it disproportionately impacts our populations of color. So when we are able to eradicate COVID, we're also able to save the lives of our community. Waiting for the vaccine, waiting for everyone else to get it, just gives the virus an opportunity to infect you and perhaps kill you or someone that you love. So it's really about, when you think about the vaccination, we're thinking about it in terms of not only our own person, but from a spiritual perspective, we're doing this because we also want to help our brothers and sisters. We want to help our families. We want to help our communities. And if you take anything, know that vaccines are the safest things that you can take.